public health concern in Orange County.
More children are coming down with RSV. KCAL 9's Leslie Marin is live in Orange with the details of this widespread impact on local hospitals. Les?
Pat, Juan, yeah, we're outside Children's Hospital of Orange County, where they have been dealing with this influx of RSV patients for a while now. In fact, they had to move some of their lobby for their ER outside just to accommodate some of these families. And they tell me that an emergency declaration that was extended here in the county is so important so that they can give the best treatments to their littlest patients.
A lot more washing hands and sanitizer.
Orange County grandmother Varnetta Soisette is taking extra precaution with her grandkids as cases of respiratory syncytial virus, or RSV, continue to rise among children.
I've worried about that ever since I've heard it.
Still seeing a lot of kids get very sick from RSV.
Catherine Williamson is a pediatrician at Children's Hospital of Orange County, where emergency departments are so full, the hospital says beds are being set up in surgical playgrounds and the discharge lounge.
The reasons why so many kids are needing to be seen in a hospital is for any difficulty breathing and if they're having a hard time getting enough fluids in, so they're getting severely dehydrated.
An influx of RSV added with flu and COVID patients is hitting hospitals all across the Southland. Pediatrician Muzna Atif is seeing some of the youngest patients at Pomona Valley Hospital.
We've been admitting some kids, really young ones, even like 1 week and 2 week old babies who are coming in with severe respiratory distress, and they're needing a lot of oxygen support.
But counties like the OC recently extended an emergency declaration to help hospitals like Chalk treat their tiny patients. Without it, the hospital could have trouble getting the medication they need.
The things that we didn't have access to were medications. Some of the extra supplies, and that the state of emergency has helped us get access to critical medications that are helpful with dealing with sicker patients now.
There is no current medication or vaccine for RSV, which typically peaks in the winter.
We may still be in for a long winter ride.
So as holidays grow closer and gatherings grow larger, pediatricians calling on parents not to let their guard down just yet.
We do need to find a balance to enjoy our families and have fun, but we also really need to reduce the risk.
So there is some good news here. We checked with Children's Hospital of LA, and they tell us that they have seen a decrease in RSV patients for the past 3 weeks. Here at Chalk, they tell me this week's numbers so far are looking better than last week, but it's being offset with more patients coming in for COVID and the flu. Reporting live from Orange, Leslie Marin, KCAL 9 News.
All right, thank you, Leslie. And now for a live look outside at downtown LA, a cold and rainy